afternoon. Great. Okay, great. So thank you very much, Jess. I'm going to touch on the blind spot of hepatitis B stigma and its implication on patient well-being in Ghana. So this is the outline of my presentation. Basically, just talk about what stigma is, and then also touch on some determinants of stigma, including manifestations, and then eventually we talk about some of the implications of stigma on the patient's well-being. So stigma as a construct has already been conceptualized by Goffman. That is just about deeply discrediting attributes that spoils a person's social identity, leading to their rejection in society, and also sometimes their full social acceptance being denied. But the interesting thing is that it's just about treating someone differently or labeling the person. But what we know is that stigma is a latent variable that you cannot measure it directly. You have to measure it through some other mechanisms. So Henshaw and his team felt that if you really want to measure stigma, then you should focus on three important mechanisms. One is stereotypes, second is prejudices, and discrimination. So stereotypes is just about the inaccurate beliefs you have about an individual. Could be, let's say, individuals with hepatitis are considered to maybe be cursed, or it could even be that you believe that these individuals, by just touching someone, could also pass the infection to the person. But then when you look at our context in Ghana here, there are quite a number of reasons why people stigmatize individuals with hepatitis. The first thing is their perception that hepatitis is highly infectious, which is the perceived infectivity. So if you look at the data that was shared by Dr. Ivonate, you realize that sweat was considered as one of the vehicles of transmission of hepatitis. So once people think that you can get this infection from sweat, then of course there's a likelihood that they will also be very careful when they are engaging you or having any interaction with you. Again, people have also seen individuals dying as a result of the complications of hepatitis. In our communities, we see people developing ascites and eventually also dying. And these are clear evidence of the outcome of the infection. And almost all the time, there's this kind of comparison between hepatitis and HIV. People have seen how people with HIV end up, like eventually dying, or looking at a certain way. So when you go on the media, and then people are having a conversation about hepatitis, they say, hepatitis is more dangerous than HIV. And the mental picture the audience gets is that, well, if someone gets hepatitis and it's more dangerous than HIV, I have seen someone with an HIV before, then it means this condition is a very terrible condition. So with that, then they will also be careful once they know that an individual is having hepatitis B. Our study also identified the fact that there are also some people who believe this is as a consequence of a curse. And of course, in our context where people are very much careful about relating with someone who has been cursed, or let's say an accursed items, then of course they don't want to be in close proximity to individuals with hepatitis. And that's also one of the determinants of stigma. And then again, norm-violating behavior. So we have our social norms. We expect you to maybe be a very good person, do not have, sex when you are not married and all that. So people feel that once you have hepatitis that could be transmitted through sex, then of course you have been in some immoral behavior, and that of course you are responsible for the disease. There are so many ways in which this stigma manifests in our context. The first is what we call relationship strains. So people always struggle as to whether to go on with even some marital arrangement with an individual that they later on see that the person is having hepatitis. So this is one of the major concerns that are also expressed by the patients. And there are also instances where people have gotten married and eventually divorced because they think that the person could also be a source of infection to them. And these are all important social-cultural environmental issues that also demonstrate stigma. There are also denied opportunities. For example, employment. We did some studies in the northern part of the country where we observed that some women who were in secondary schools and they were screened had to lose their job because they felt that they have hepatitis and therefore they cannot continue to be in that environment. Again, people also apply for some security agency jobs and they are not considered because the pre-screening also shows that this person has hepatitis and eventually the person is taken out of the list because the person is positive for hepatitis B. Then social exclusion, which of course can also be in the home, because we've seen individuals with hepatitis that the home is structured in a way that your cutlery, everything is separated from the others, including your eating utensils. And then again, even in the schools, there was this study we did in the northern part of the country where students were sent to the dormitories they were sent to the classrooms instead of the dormitories because they tested hepatitis B positive. And the school felt that these individuals could also be a source of infection to others, and therefore they were not allowed to be in the dormitories, but they were asked to rent accommodation outside the campus. But the most scary bit of it is when we identify that even in some places, when you die as a result of hepatitis, you are buried in a valley. So you are taken out of the cemetery, you are buried far away from the community because they feel that this is not something you should even be closer to the community. So even until death, these individuals are stigmatized. Then travel restriction is something that is very common and we all know. But the most concerning part of it is even in our healthcare environment. So excessive cautiousness by healthcare providers is something that we also observed. Again, we also observed that there were some procedure postponements. So for example, if it so happens that you have to perform a procedure for you, then because I know you have hepatitis, for example, if it's an invasive procedure, then I will obviously postpone the procedure and consider maybe another patient until eventually another person who is comfortable will offer that service. Then breaches of confidentiality, even among healthcare providers, discussing hepatitis B status of clients, and to a larger extent, even going beyond the hospital environment to the outside, the patient's home and all that. Then there was something also interesting that happened, and that is about, So there was something also that happened that's about task shifting. So we also observed that some senior colleagues were task shifting, instead of performing an activity, they would just ask their junior colleagues to perform those activities, especially they were referring that one to student nurses who were not privy to the status of these patients. That's very interesting. So if you look at the implication, of course, we know it comes to psychological distress, depression, anxiety, low self-esteem, and these are really documented evidence out there when individuals are stigmatized. And beyond that, the emotional burden they have to go through, the guilt itself, especially when the people feel that they are being blamed for what they currently have, which is their condition, and the internalized shame, which they don't even talk about it. So the person feels ashamed, but these are conversations that are not openly discussed. Then the low health-related quality of life, so many evidence out there. One of our study, we identified almost about 75% of the population having low quality of life. Then fear of infecting others, which is really psychologically also troubling because you have a disease that you think that you can potentially also pass it on to someone, and that alone, especially if it's about mother-to-child transmission, then it becomes a big deal. And withdrawal from society, sometimes. I met one young guy who said he's now hopeless. He doesn't even want to think about his future plan because he's going to die anyway, so why should he even invest in his life? And then he's just blowing his time off. Then poor care engagement, and I think Jess mentioned, eventually when this happens, they even conceal their status and they don't even have open conversation for you to even link them to care. So eventually these individuals, even when they come to the hospital, they don't have strong support, and retention in care is also one of the major challenges that comes with it. So I think that if we really want to address stigma, then we should use the socio-ecological approach. Let's look at it from the individual level. What can we do? It's important we look at hepatitis literacy because mostly some of these stigma are driven by lack of understanding about the etiology of the disease and the mere fact that people think that they could get infected and therefore they just want to be careful about those with the condition. Again, if we have support group, then of course these individuals can draw inspiration from the life experiences and even the coping strategies that are used by others and they can live their life. Storytelling is one of the greatest, model now, and Hepatitis B Foundation, US, is using it powerfully. This is something that, of course, we can also draw inspiration from, and it will also help these individuals to cope with the stigma. At the family level, I think that anti-stigma initiative, and it's about positive language. For example, it's not about hepatitis B patient, but it could be a person with hepatitis B. That alone is more acceptable than using some stigmatizing statements, which obviously also affect them psychologically. And then open communication, especially if it's about spouses sometimes, they don't even know whether they can have sex with their partners because they think that just by having sex, they could get an infection from their partners, and this open communication should also be discussed at the family level. So at the community level, of course, public awareness campaign using the media, because the media is a very powerful tool that we can use to drive some of this information to the public, because the whole idea is that once we use the media, we are likely to have a wider coverage, especially in Ghana, where a lot of people use the radio and television as well, including the social media. But at the structural level, and this is very important, if we have provider-focused stigma training, which of course these individuals' capacity are built, that the mere fact that you are providing a service to someone with hepatitis B as a healthcare provider doesn't necessarily mean that you can also get an infection. Of course, there are vaccines available, and once you are covered, you are covered. And then policy advocacy, which is at the structural level, because this is also very important. Even though we have stigma the documents regarding HIV, but the extent to which this can also be generalized to hepatitis B is something that we don't know. So these are very important conversations that we need to have. Thank you very much.